Why helpful EPPP answers can be wrong. Ethics questions on the EPPP often involve a request that sounds reasonable because it is tied to a real problem. In a custody dispute, a client may ask the treating psychologist to write a letter supporting the client's parenting. A parent might demand details about what an adolescent client disclosed during a therapy session. An attorney may press for an opinion that would strengthen a legal case, while an employer may ask whether an employee can safely return to work. The details change across questions, but the trap is consistent. The wrong answer treats the seriousness of the request as enough reason for the psychologist to act. Before choosing it, identify the action being recommended and ask whether the information in the question supports that action. A custody letter question might be testing role clarity. A psychologist who provides therapy has a treatment relationship with the client, but it does not by itself support a statement that the client should receive custody or that the other parent is less fit. A custody recommendation requires a different kind of evaluation, different data, and attention to the legal question being asked. When an answer choice turns a treating psychologist into a custody evaluator because the client needs support, it is likely the trap. The safer answer keeps the psychologist inside the role already established by the context provided in the question. The psychologist may explain what can and cannot be included in a letter, obtain proper authorization before releasing any information, and provide only information that can be supported by the treatment record. The key is to avoid conclusions that sound helpful, but go beyond the data. Boundary questions often use a different kind of pressure. A client may invite the psychologist to a wedding, graduation, performance, religious ceremony, or other meaningful event. The tempting answer accepts because the invitation seems important to the client. It may even say that attending would validate the client's progress or strengthen the therapeutic relationship. This answer treats the client's emotional need as enough reason to change the treatment frame. A correct answer maintains the boundary and addresses the request in therapy. The psychologist can acknowledge that the event is important, ask what the invitation means to the client, and discuss the client's reaction to the limit. A psychologist does not have to ignore the meaning of the request in order to maintain the boundary. The correct answer protects the professional relationship from role confusion, dependency, special treatment, or future harm. Confidentiality questions can make disclosure sound practical, especially when another person has a reasonable concern. A parent may be frightened by an adolescent client's behavior. A spouse may suspect ongoing substance use. A physician may need information for coordination of care. An employer may want reassurance about workplace safety. The wrong answer releases information because disclosure would reduce uncertainty or make the situation easier to manage. A better answer checks the conditions for disclosure first. Has the client authorized the release? What information is covered by the authorization? Does the law require disclosure? Has risk reached a level that changes the psychologist's duty? If disclosure is required or permitted, the psychologist should share only what is necessary. Competence questions can also be framed as helpfulness. A psychologist may be asked to treat a concern outside their training, interpret a specialized assessment, provide an opinion in an unfamiliar setting, or continue services because no one else is available. The tempting wrong answer proceeds because the client needs help. The correct answer keeps services within competence while arranging appropriate support. Depending on the facts in the question, this may involve consultation, supervision, referral, additional training, or limited interim services that fall within the psychologist's actual competence. When an answer sounds helpful, look closely at the action it asks the psychologist to take. Is therapy being turned into forensic evaluation? Is confidential information being released without client authorization, a legal requirement, or a risk-based duty to disclose? Is a boundary being changed because the request feels meaningful? Is the psychologist being pulled into work that requires additional competence? The safest habit is to name the action first, then check whether the question provides enough information to justify taking it.